Dan selamat petang. Okey, untuk subjek dalam pre-hospital care untuk saya punya clinical assessment saya akan membentangkan tajuk polytrauma. Okey. Okey, apakah itu polytrauma? Polytrauma is when a person has suffered multiple injury, some of which can result in significant disability and may even result in loss of life. Polytrauma is also a medical condition is which a person experience serious injuries or traumas to several parts of the body simultaneously. This injury may involve internal organ, bone, muscle, nerves or other system in the body. The component of polytrauma can vary depending on the specific injury and severity experienced by the victim. Cause of polytrauma. Okay. Road traffic accident, example MBA. Drive under alcohol influence, sleepy during the drive. Industrial injury, example fall from height. Sport injury in hardcore activity. Criminal case, example assaulted, gunshot. Okay, injury in polytrauma. Injury in polytrauma involves several parts of which can involve various body, system and organ. Head injury includes brain injury such as brain hemorrhage, concussion or other brain structural injuries. This can occur as a result of shock or trauma to the head. Spinal injury may include a fractured spine, spinal cord injury or injury to the neck or back. Chest injury may include broken ribs, lung injuries or heart injuries. Abdominal injuries may include injuries to internal organs such as the liver, pancreas or intestine. Pelvic injury may include pelvic fractures or injuries to pelvic organs such as the bladder or rectum. Limb injuries may include bone, joint or nerve injuries in the arms or legs. Skin and soft tissue injury may include open wounds, burns or injuries to soft tissue such as muscle or tendons. Okay, classification of polytrauma. Injury severity scores. The injury severity score is a scoring system that combines the severity or injuries to 6 different body regions: head, face, chest, abdomen, extremities and spine, to provide an overall score that reflects injury severity. Polytrauma recent injury severity score. The NIS is an alternative scoring system that calculates a score based on the 3 most severe injury an individual has sustained without assessing the specific location of the injury. Abbreviative Injury Scale, AIS. The AIS is a classification system that describes the level of injury to each part of the body separately. The AI score is used in scoring systems such as the IS or NIS to estimate the overall polytrauma score. Kampala Trauma Score. The KTS is a scoring system used to classify polytrauma based on the severity of head injury, chest injury, and systolic blood pressure. Okay, I want to show my case study. Okay, Mr. P. Ramasamy, anak lelaki paling depan, 58-year-old, was involved in the road accident when the car he was driving crashed into road divider at around 4 in the morning. According to witness, the car is driving continuously crashed, maybe to drunk driving, based on the medical officer examination on duty while providing treatment. There was a smell alcohol detect. Even the victim was still in a semi-conscious state in the car when the accident occurred and was suspect, successfully removed by the public and also the authorities. The Glasgow Coma Scale examination show that the eye-opening score is 1/4. The verbal response was 2/5 and the motor response was 3/6. The overall score is 6/15. The pupil score examination is 3/3 reactive. Patient also have a bleeding from oral cavity, bleeding from scalp and left knee. The examination of the cervical part also shows sign of injury. Possibly, the impact of the accident has suffered. The addition also, the respiratory tract also show partial, which is half closed, fearing that there are a sign of fracture of the mandible. Examination of the chest show the patient breathing at a rate 28 per second. Inspection show multiple abrasion wound over anterior chest. In fact, there is also an abrasion wound on the chest. Chest movement show crepitus felt over left side chest. No subcutaneous emphysema. There are fracture in the rib but no sign of pneumothorax. The circulation examination show that the skin color was pink. The body temperature was warm, the capillary refill time under 2 seconds, and the heart rate examination show no murmurs. Patient also have nose bleeding and loss of conscious. Airway patency show partial. In physical examination at left upper limb show abrasion wound over left shoulder. No IBS deformity. Radial pulse palpable. Capillary refill time is below 2 seconds. Unable to access neurology. Right upper limb show deep laceration wound over palm and third web space. Tendinosis test normal. No active bleeding. No gross deformity over arm and forearm. Capillary refill time below 2 seconds. Radial pulse palpable. Unable to access neurology. In the lower limb deep laceration wound, left knee with traumatic arthrotomy. Patellar tendon partial tears. No other gross deformity. Dorsally pedis artery and cutaneous transluminal angioplasty not palpable. Popliteal pulse not good wave from at right big toe to left toe. Femoral pulse strong. Capillary refill time below 2 seconds. SPO over 99%. Good wave form at right big toe to left toe. In right lower limb show swelling deformity right proximal type. No right knee effusion. Dorsally pedis artery and cutaneous transluminal angioplasty palpable but feeble. Capillary refill time below 2 seconds. SPO increase 99%. Good waveform at right big toe to left toe. Unable to access neurology. No gross deformity over tibia or foot. Log roll, no stop deformity. No open wound over spine region. Correct examination show tone intact. Head examination laceration wound over midline parietal area. Neck patient on cervical collar. No deformity. Chest spring. No mobile segment. Rib fracture at left lateral lower chest. Right clavicle fracture. No skin painting. Pelvic examination show pelvic spring stable. No mobile segment. Okay, observation. Blood pressure is 110 over 64. Pulse rate 109. Temperature 337. SPO 90% under face mask. One. Okay. X-ray examination finding. Chest dia. Left lower rib fracture, no pneumothorax. Pelvic, right proximal third femur fracture, no other fracture seen. Left radius ulna, no obvious fracture seen. All fracture left elbow. Right hand, no obvious fracture seen, but oblique view. Metacarpal bone overlap. Right radius or ulna, no obvious fracture seen. Right femur or proximal third femur fracture, subtrochanteric. Right knee, tibia or fibula, not obvious fracture. Left knee or femur, not obvious fracture seen or lateral, view rotated. Okay, CT scan finding. Brain, depressed skull fracture extending to left femoral. Then axial hemorrhage 0.7 cm left anterior and right anterior temporal. Scalp hematoma at left frontal temporal parietal multiple facial bone fracture. Cervical osteophyte seen but alignment intact, no obvious fracture. Spine spears fracture, spine spears process T1 fracture, no cervical fracture. Lung contusion, right clavicle fracture. Abdomen, no solid intra-abdominal injury. Pelvis, fracture at anterior and posterior wall of left acetabulum. Fracture at left wall but not hip dislocation. Fracture at right proximal femur. Glasgow Coma Scale, I respond 1/4, verbal response 2/5, motor response 3/6. Management, vital sign and SpO2 monitoring. Keep SpO until 98%. Proceed with intubation and medication preparation. IV fentanyl 10 mg, IV etomidate 2 mg, IV scopolamine 100 mg. Inside rescue, keep cervical collar to support the neck and reduce cervical movement. IM anti-tetanus toxic 0.5 mg stat. IV rosapine 2 gram stat. IV triazolic acid, blood transfuse 2.0 pint. IV pantoprazole 40 mg stat. Start dressing of left lower limb and right lower limb. Insert catheter bladder drainage and monitor input output chart and color of urine. Any hematuria or no? IV vitamin 100 mg stat. Apply splint at right lower limb. Start IV drip normal saline 4 pints for 24 hours. Refer to auto and neurosurgical for future plan. IV cefuroxime 1.5 mg stat. Subcatheter unit start to control sugar in the blood. IV noradrenaline 8 mg and 50 cc dextrose 5. Okay, thank you.